Plyometrics. In sports training and rehabilitation of athletic injuries, the concept of specificity has emerged as an important parameter in determining the proper choice and sequence of exercise in a training program. Jumping is an inherent activity in most sports such as basketball, volleyball, gymnastics, and aerobic dancing. Even running is a repeated series of jump-landing cycles. Therefore, jump and landing training should be used in the design and implementation of the overall training program. The roots of plyometric training can be traced back to Eastern Europe, where it was simply known as jump training. The term plyometrics was coined by an American track and field coach named Fred Wilt. Its Greek origins are pilo and metric, which mean more and measure respectively. Plyometrics is defined as a quick, powerful movement involving a pre-stretching of the muscle and activating the stretch-shortening cycle to produce a subsequently stronger concentric contraction. It takes advantage of the length-shortening cycle to increase muscular power. Plyometrics is the use of a quick movement of eccentric activity, followed by a burst of concentric activity to produce a desired, powerful output of a muscle. A plyometric exercise is one that facilitates a muscle to produce a maximum strength output as quickly as possible. Power is calculated as force times distance divided by time. The quicker the time, the greater the power. Within this equation, if we can decrease the amount of time it takes to complete a skill task, then it will produce more power. Because of the muscle activation involved in plyometrics, sometimes it is referred to as a stretch-shortening activity. Also, because of the muscle activation involved in plyometrics, this technique should be utilized for conditioning healthy individuals. During the rehabilitation cycle, plyometrics is commonly applied between the strength and the functional activities during therapeutic exercise and intervention. Many daily activities are essentially stretch-shortening activities. However, plyometrics are a more aggressive activity with the expressed purpose of improving a patient's output or performance through the utilization of several physiological and neuromuscular aspects. Plyometric exercise phases. We start with an eccentric contraction. This eccentric contraction is also called the stretch phase, the pre-stretch phase, or the cocking phase. Elastic energy is stored in the series elastic components, and the muscle spindles are stimulated. This occurs when a muscle is pre-stretched as it is actively lengthened. The second phase is the amortization phase. This is the amount of time it takes to change from eccentric to a concentric contraction. Afferent nerve synapses with alpha motor neurons become activated. The alpha motor neurons transmit signals to the agonist muscle, telling it to contract concentrically. The last phase is the concentric contraction. This is also known as the outcome phase. Elastic energy is released from the series elastic components. The alpha motor neurons stimulate the agonist muscle group to continue to contract and allow for a concentric movement to occur in the body. The goal of plyometric training is to decrease the amount of time required between the yielding eccentric muscle contraction and the initiation of the overcoming concentric contraction. Normal movement rarely starts from a static position. Rather, it is preceded by an eccentric pre-stretch that loads the muscle and prepares it for the ensuing concentric contraction. The coupling of the eccentric-concentric muscle contraction is known as the stretch-shortening cycle. The physiology of this stretch-shortening cycle can be broken down into two components: proprioceptive reflexes and the elastic property of the muscle fibers. These two components work together to produce a response. There are mechanical and neurological components of plyometrics. Combined, these components create optimal power output during rapid performance of an activity. The mechanical characteristics of a muscle can be represented by a three-component model: a contractile component, a series elastic component, and a parallel elastic component. All interact to produce a force output. Although the contractile component is usually the focal point of motor control, the series elastic component and parallel elastic component also play important roles in providing stability and integrity of the individual muscle fibers when a muscle is lengthened. During this lengthening process, energy is stored within the musculature in the form of kinetic energy. When a muscle contracts in a concentric contraction, most of the force that is produced comes from the muscle fiber filaments sliding past one another. Force is registered externally by being transferred through the series elastic component. When eccentric contraction occurs, the muscle lengthens like a spring. With this lengthening, the series elastic components are also stretched and allowed to contribute to the overall force production. The total force production is the sum of the force produced by the contractile component and the stretching of the series elastic component. An analogy that might be helpful would be the stretching of a rubber band. When a stretch is applied, potential energy is stored and applied as it returns to its original length when the stretch is released. Significant increases in concentric muscle force production have been documented when immediately preceded by an eccentric contraction. This might be partially a result of the storage of elastic energy, because the muscles are able to use the force produced by the series elastic component. When the muscle contracts in a concentric contraction, the elastic energy that is stored in the series elastic component can be recovered and used to augment the shortening contraction. The ability to use the stored elastic energy is affected by three variables: time, the magnitude of the stretch, and the velocity of the stretch. The type of muscle fiber involved in the contraction can affect the storage of elastic energy. Fast-twitch muscle fibers respond to a high-speed, small-amplitude pre-stretch. The amount of elastic energy used was proportional to the amount stored. When a long, slow stretch is applied to muscle, slow and fast-twitch fibers exhibit a similar amount of stored elastic energy. However, this stored energy is used to a greater extent with the slow-twitch fibers. This would suggest that slow-twitch fibers might be able to use elastic energy more efficiently in ballistic movement characterized by long, slow pre-stretching in the stretch shortening cycle. The proprioceptive stretch reflex is the other mechanism by which force can be produced during the stretch shortening cycle. Mechanoreceptors located within the muscle provide information about the degree of muscular stretch. This information is then transmitted to the central nervous system and becomes capable of influencing muscle tone, motor execution programs, and kinesthetic awareness. The mechanoreceptors that are primarily responsible for the stretch reflex are the Golgi tendon organs and the muscle spindles. The muscle spindle is a complex stretch receptor that is located parallel within the muscle fibers. Sensory information regarding the length of the muscle spindle and the rate of the applied stretch is transmitted to the central nervous system. If the length of the surrounding muscle fibers is less than that of the spindle, the frequency of the nerve impulses from the spindle is reduced. When the muscle spindle becomes stretched, an afferent sensory response is produced and transmitted to the central nervous system. Neurological impulses are sent back to the muscle, causing a motor response. As the muscle contracts, the stretch on the muscle spindle is relieved, thereby removing the original stimulus. The strength of the muscle spindle response is determined by the rate of stretch. The more rapidly the load is applied to the muscle, the greater the firing frequency of the spindle and resultant reflexive muscle contraction. The Golgi tendon organ lies within the muscle tendon, near the point of attachment of the muscle fiber to the tendon. Unlike the facilitatory action of the muscle spindle, the Golgi tendon organ has an inhibitory effect on the muscle by contributing to a tension-limiting reflex. Because the Golgi tendon organs are in a series of alignment with the contracting muscle fibers, they become activated with tension or stretch within the muscle. Upon activation, sensory impulses are transmitted to the central nervous system. These sensory impulses can cause an inhibition of the alpha motor neurons of the contracting muscle and its synergist, thereby limiting the amount of force produced. With the concentric muscle contraction, the activity of the muscle spindle is reduced because of the surrounding muscle fibers are then shortening. During an eccentric muscle contraction, the muscle stretch reflex generates more tension in the lengthening muscle. When the tension within the muscle reaches a potentially harmful level, the Golgi tendon organ systems oppose each other, and increasing force is produced. The descending neural pathway from the brain helps to balance these forces and ultimately controls which reflex will dominate. The degree of muscle fiber elongation is dependent upon three physiological factors. Fiber length is proportional to the amount of stretching force applied to the muscle. The ultimate elongation or deformation is also dependent upon the absolute strength of the individual muscle fibers. The stronger the tensile strength, the less elongation that will occur. The last factor for elongation is the ability of the muscle spindle to produce a neurophysiological response. A muscle spindle with a low intensity level will result in difficulty in overcoming the rapid elongation and therefore produce a less powerful response. Plyometric training will assist in enhancing muscular control within the neurological system. The last mechanism in which plyometric training might improve muscular performance centers around neuromuscular coordination. The speed of muscular contraction can be limited by neuromuscular coordination. The body can move only within a set speed range, no matter how strong the muscles are. Training with explosive pre-stretch of the muscle can improve the neural efficiency, thereby increasing neuromuscular performance. Plyometric training promotes changes in the neuromuscular system, allowing the individual to have better control of the contracting muscles and its synergists, yielding a greater net force, even in the absence of morphological adaptations of the muscle. This neural adaptation can increase performance by enhancing the nervous system to become more automatic. Plyometric training relies more on the rate of stretch than on the length of stretch. Emphasis should center on the reduction of the amortization phase. If the amortization phase is slow, the elastic energy is lost as heat and the stretch reflex is not activated. Conversely, the quicker the individual is able to switch from yielding eccentric work to overcoming concentric work, the more powerful the response. Some pre-plyometric considerations. Specificity is the key concept in any training program. Sport-specific activities should be analyzed and broken down into basic movement patterns. These specific movement patterns should then be stressed in a gradual fashion based upon individual tolerance to these activities. The development of a plyometric program should begin by establishing an adequate strength base that will allow the body to withstand the large stress that will be placed upon it. A greater strength base will allow for greater force production because of increased muscular cross-sectional areas that can contribute to this series elastic component and subsequently can store a greater amount of elastic energy. Because eccentric muscle strength is an important component to plyometric training, it is especially important to ensure an adequate eccentric strength base is present prior to beginning activity. Before an individual is allowed to begin a plyometric regimen, a program of closed kinetic chain stability training should focus on eccentric lower quarter strength and should be initiated early. In addition to strengthening in a functional manner, closed chain weight-bearing exercises also allow the individual to use functional movement patterns. The same holds true for adequate upper extremity strength prior to initiating an upper extremity plyometric program. Closed chain activities such as wall push-ups, traditional push-ups, and their modification, as well as functional tests, can be used to ascertain readiness for upper extremity plyometrics. Flexibility, proprioception, balance, and coordination are extremely important to the ability of an individual to perform plyometric activities. Flexibility is important due to the high amount of stress that is applied to the musculoskeletal system. All plyometric training sessions should begin with a general warm-up and flexibility exercise program. The warm-up should produce mild sweating. The flexibility exercise program should address muscle groups involved in the plyometric program and should include static and short dynamic stretching techniques. Once cleared to participate in the plyometric program, precautionary safety tips should be adhered to. A plyometric program design. As with any conditioning program, the plyometric training can be manipulated through training variables such as direction of body movement, the weight of the individual, speed of execution, external loads, intensity, volume, frequency, training age, and recovery time. The direction of the body movement. Horizontal body movement is less stressful than vertical movement. This is dependent upon the weight of the patient and the technical proficiency demonstrated during jumps. Intensity. Intensity can be defined as the amount of effort exerted. With traditional weightlifting, intensity can be modified by changing the amount of weight that is lifted. With plyometric training, intensity can be controlled by the type of exercise that is performed. Double leg jumping is less stressful than single leg jumping. As with all functional exercise, the plyometric exercise program should progress from simple to complex activities. Intensity can be further increased by altering the specific exercises. The addition of external weights or raising the height of a step or box will increase the exercise intensity. Volume. Volume is the total amount of work that is performed in a single workout session. With weight training, volume would be recorded as the total amount of weight that was lifted, weight times the repetitions. Volume of plyometric training is measured by counting the total number of foot contacts. The recommended volume of foot contacts in any one session will vary inversely with the intensity of the exercise. A beginner should start with low-intensity exercise with a volume of about 75 to 100 foot contacts. As ability is increased, the volume is increased to 200 to 250 foot contacts of low to moderate intensity. Recovery. Rest time is used between exercise sets. Manipulation of this variable will depend upon whether the goal is to increase power or muscular endurance. Plyometric training is anaerobic in nature. A longer recovery period should be used to allow restoration of metabolic stores. With power training, a work-to-rest ratio of 1:3 or 1:4 should be used. This time frame will allow maximal recovery between sets. For endurance training, this work-to-rest ratio can be shortened to 1:1 or even 1:2. Endurance training typically uses circuit training where individuals move from one exercise set to another with minimal rest in between. Frequency. Frequency is the number of times an exercise session is performed during a training cycle. With weight training, the frequency of the exercise has typically been 3 times a week. Unfortunately, research on the frequency of plyometric exercise has not been conducted. Therefore, the optimum frequency for increased performance is not known. It has been suggested that 48 to 72 hours of rest are necessary for full recovery before the next training stimulus. Intensity plays a major role in the recovery period. Muscle fatigue will result with a corresponding increase in neuromuscular reaction times. The beginner should allow at least 48 hours between training sessions. Other plyometric program considerations. Age. We need to be careful using plyometric training in prepubescent and early pubescent patients. These exercises should remain at low volume and low intensity. Children are at a higher risk than older individuals for injury because their central nervous systems are not mature and their Golgi tendon organ activation threshold is lower than adults. We need to think about body weight. The design of a plyometric program must take into account the patient's weight. The heavier the participant, the more force is delivered to the body during plyometric movements. Intensity of plyometric exercises for heavier patients should be selected cautiously. Competitive level. Patients involved in competitive sports are more appropriate candidates for moderate and high-level plyometric exercises than those in recreational activities. The surface. The best surface for plyometric lower extremity activities are those that have little give to them. The surface should be one that yields to absorb some of the impact stress of the plyometric activity. Ideal surfaces are spring-loaded floors. Although the surface should be able to absorb some of the impact forces produced during the activity, it also should not be so yielding that it reduces the elastic recoil, the crucial element of plyometric activity. Footwear. Shoes that offer good support and provide some cushion for shock absorption are the best shoes to wear for plyometrics. Shoes should be in good condition, not excessively worn, tied properly, and fit well. The proper technique. Technique is probably the most important among the special considerations. Foot position is an essential factor in jumping activities. The patient should land on the midfoot and then roll forward to push off the balls of the feet. The patient should not land on the balls of the feet or the heel, since these landing techniques increase the impact of forces and thereby increase stress applied at the foot, ankle, and knee. The trunk should remain upright to sum the forces from the back, abdominals, and the arms. The quality of the execution is important. As the patient fatigues, performance quality declines. This can result in 2 issues. 1, the risk of injury, and 2, developing the improper engram. This means that they're developing bad habits that they're going to have to unlearn. It is important to know the proper exercise technique and to observe the patient's performance closely so that you can discontinue the exercise when performance begins to deteriorate. Progression, a gradual progression from simple to difficult, from few to more, and from general to specific, is vital to avoid injury in plyometric activities. Goals. The program goals are individually dictated by the patient and the demand of the patient's sport. Some precautions to think about. Plyometric training takes time. In addition, there could be post-exercise delayed onset muscle soreness, so we need to think about when we're performing these activities within the scope of an athlete's exercise progression. Contraindications would include things like active inflammation, post-operative conditions, and joint instability. Some examples of equipment that we can use for plyometric activity may include things like cones, boxes, hurdles, medicine balls, and even commercially available plyometric equipment. Some examples of lower extremity plyometrics. We can progress through 6 types of exercises. We can start with a jump in place, standing jumps, progress to multiple jumps and hops, bounding drills, box jumps, and then eventually depth jumps. Some examples of upper extremity and trunk plyometrics may include activities that mimic sport demand. Plyometric activity should always provide a progression from easy to difficult and should be performed with a controlled speed of movement.